STEC producing E. coli 0104H4 outbreak in Germany. Shiga toxin is one of the most potent toxins known to man, so much that Centers for Disease Control and Prevention list it as a potential bioterrorist agent. Most kinds of E. coli bacteria do not cause disease in humans. Indeed, some are beneficial, and some cause infections other than gastrointestinal infections, such as urinary tract infections. E. coli isn't usually disease-causing, a major commensal in humans. Some kinds of E. coli cause disease by making a toxin called Shiga toxin. The bacteria that makes these toxins are called Shiga toxin producing E. coli, or STEC for short. You might hear them called verocytotoxin E. coli, VTEC, or enterohemorrhagic E. coli, EHEC. These all refer generally to the same group of bacteria. The most commonly identified STEC in North America is E. coli 0157, or even just 0157. When you hear news reports about outbreaks of E. coli infections, they're usually talking about E. coli 0157. E. coli 0104 resembles the serotype 0157. This serotype is a rare variety of E. coli that produces toxins that are capable of inflicting damage to the lining of the intestine. These toxins are closely related to or identical to the toxin produced by Shigella dysentery and are referred to as Shiga toxins. In very rare instances, the infection can progress to hemolytic uremic syndrome, or better known as HUS, and kidney failure. E. coli 0157H7 can survive at low temperatures as well as acidic conditions, and the infectious dose is relatively small. It has been observed that E. coli 0104H4 has picked up some new genes, almost certainly through horizontal gene transfer, in which it stretches the DNA that are picked up from other E. coli strains or possibly different species entirely. Once incorporated into the genome, the new genes can provide bacteria with entirely novel properties. In this case of E. coli 0104H4, tests have shown that it now carries a gene for Shiga toxin, which is commonly found in other disease-causing strains of this species. The toxins produced by STEC were named based on their similarity in structure and function to Shiga toxins produced by Shigella dysentery. Shiga toxin 1 is neutralized by antibodies against Shiga toxin, whereas Shiga toxin 2 is not neutralized by antibodies against Shiga toxin, but is neutralized by homologous antibodies. The new strain of E. coli 0104H4 appeared to be a hybrid of two different E. coli types. The hybrid strain also contains the Shiga-like toxin from enterohemorrhagic E. coli. This toxin binds to and damages kidney cells and can lead to potentially fatal HUS. Symptoms of STEC infection include stomach cramps, diarrhea, which is often bloody, and vomiting. If there is fever, it is usually not very high. Most people get better within 5 to 7 days, but some patients go on to develop HUS, usually about a week after the diarrhea starts. Symptoms of HUS include a decreased frequency of urination, feeling very tired, and losing pink color to skin and membranes to anemia. Around 5 to 10% of those who are diagnosed with STEC infection develop a potentially life-threatening complication known as hemolytic uremic syndrome, HUS. Clues that a person is developing HUS include decreased frequency of urination, feeling very tired, and a person with HUS should be hospitalized because the kidneys may stop working and they may develop other serious problems. Most persons with HUS recover within a few weeks, but some suffer permanent damage or die. This picture just shows a person with hemolytic uremic syndrome rashes that can occur as well. Early diagnosis of STEC infection is important for determining the proper treatment promptly. Initiation of parental volume expansion early in the course of STEC infection might decrease renal damage and improve patient outcome. In the outbreak in Germany, they first pointed a finger at Spanish cucumbers. Then they cast suspicion on sprouts from Germany. Now German officials appear dumbfounded as to the source of the deadliest E. coli outbreak in modern history. Backtracking for the second time in a week, officials said that preliminary tests have found no evidence that vegetable sprouts from an organic farm in northern Germany were to blame. The surprise U-turn came only a day after the same state agency held a news conference to announce that the sprouts appear to be the culprit in the outbreak that has killed 22 people and made more than 2,330 others sick across Europe, most of them in Germany over the past month. The first case in Germany's E. coli outbreak was reported on May 1st. Soon, an average of 9 cases a day were being reported, rising to 122 cases on May 23rd alone. Germany's main Center for Disease and Control, the Robert Koch Institute, deployed 10 teams to outbreak hotspots such as restaurants and canteens and to ask patients exactly what they ate for each course. To double-check the data, customers of these establishments who did not fall ill have been interviewed as well. Officials have also sifted through the contents of rubbish bins and fridges and sent them for analysis. Specialists working around the clock at RKI headquarters in Berlin cross-checked the data, looking for what the institute's president called a common denominator. So far, that's pointed the finger of blame at raw vegetables. Cases have now been notified from 11 countries in addition to Germany. These are typically people who have visited Germany or in one case had contact with a visitor from northern Germany who was an E. coli case. The outbreak has killed 22 people, 21 in Germany and 1 in Sweden. Germany's National Disease Control Center, the Robert Koch Institute, raised the number of infections in Germany to 2,325. The number of victims hospitalized in intensive care with a rare serious complication that may lead to kidney failure rose by 12 to 642. The institute said the number of new cases is declining, a sign the epidemic might have reached its peak, but added it was not certain whether the decrease will continue. Bean sprouts have been associated with previous health scares. In 2010, they were linked to an outbreak of salmonella in Britain. In the United States since 1996, there has been at least 30 reported outbreaks of food-carried illnesses associated with different types of raw and lightly cooked sprouts. Most of these outbreaks were caused by salmonella and E. coli. This image just shows the genetic code of the EHEC bacteria 0104 that has been decoded by German scientists in a laboratory at the Eppendorf University Clinic in Hamburg. This picture reveals a doctor who is treating an E. coli patient at the intensive care unit at Asklepios Hospital in Hamburg, Altona, Germany. The European Union will propose offering at least €150 million in compensation to farmers affected by the E. coli outbreak. Spain has already been estimated that their growers have lost €200 million in sales in the weeks since Germany initially blamed the outbreak on Spanish cucumbers. There are many ways of prevention from this outbreak. Ways to help would be washing your hands. Washing hands thoroughly after using the bathroom or changing diapers and before preparing or eating food could help prevent an outbreak of E. coli. Washing your hands after contact with animals or their environment is also very crucial. Another way to help is to make sure your meat is cooked thoroughly. Ground beef and meat that has been needle tenderized should be cooked to a temperature of at least 160 degrees Fahrenheit or 70 degrees Celsius. It's best to use the thermometer, as color is not a very reliable indicator of this. Another thing to avoid is raw milk, unpasteurized dairy products, and unpasteurized juices, like fresh apple cider. Also avoid swallowing water when swimming or playing in lakes, ponds, streams, and pools. Another way of prevention is cross-contamination of food. Thoroughly washing your hands, counters, cutting boards, and utensils after touching raw meat is also an important way to prevent an outbreak. It is also important to understand that antibiotics might increase the risk for HUS in patients infected with STEC, and antidiarrheal medication might worsen the illness as well.